some time to see my presentation on posterior fossa strokes. Hello friends, I'm so happy you have taken some time to see my presentation on posterior fossa strokes. I have used the conventional work for these hemorrhagic and ischemic infarcts. But as a neurosurgeon, for us, these are one of the most significant and life-threatening emergencies, and they have remarkable outcomes if they are seen properly and an adequate treatment response is given to this dangerous condition. This is a few of my cases which we have managed at the Institute of Neurosciences at Apollo Specialty Hospital, OMR, Chennai. At Apollo OMR, we celebrate a decade from 2014 to 2024 of taking care of brain attacks from the very beginning, as from the inception, a state-of-the-art Cath lab and the Apollo protocols for management of strokes were very well established from 2014. Using an active stroke program with emergency physicians, neurologists, critical care specialists, neurosurgeons, interventional radiologists. Dr. Sengotuvan is my interventional radiologist, cardiologist like Dr. Arul, ophthalmologist, my own wife, Dr. Meenakshi Pandey. We have a dedicated team, and on top of that, there is a brilliant group of neurosurgeons and neuro-rehabilitation people who help our patients get better. And these are the people whom we celebrate. So it is not the neurosurgeon who operates, as you can see in the middle picture, but this small group of patients require the complete care of a neurosurgical unit attuned to taking care of critical patients. And this small group of posterior fossa patients will require a neurosurgeon to urgently decompress the brain and use CSF diversion procedures like external ventricular drain or ventriculoperitoneal drain to take care of the acute hydrocephalus. The majority of these patients with strokes are in the supratentorial, that is the middle cerebral artery strokes, especially in the young people, where these strokes can swell and become life-threatening. Of these strokes which require the neurosurgeon's intervention, the most lethal and devastating are the posterior fossa infarcts, which are mostly cerebellar strokes with very sudden and accelerated progression. And you can see that this patient which has a large posterior fossa infarct would be best helped by a rapid decompression, where we remove the infarcted tissue and remove the pressure from the critical structures of the brain. These do not give time for evaluation, and many times there may not be enough time for a DSA angiogram, as a progressive mass in the small constrained posterior fossa causes pressure on the brainstem and acute hydrocephalus, and this is a lethal condition, especially in young people. Now this lady, case 1, is a 46-year-old lady, professional. She had vertigo and headache and neck pain and progressive drowsiness. She was evaluated at a smaller hospital where a CT scan, which you can see, did not show any signs of any abnormality. But then she became progressively drowsier, and then she was referred to me. And as you can see now, there is a full-blown posterior cerebellar infarct, and she's only 46. So now this lady, professional with vertigo, she underwent emergency left posterior fossa decompression, EVD, and the outcomes of patients, I personally feel, are best described by the patient itself, And
Hello, I am Yashoda Vijay Kumar. I wanted to share my experience with Apollo Hospital in OMR Chennai and the incredible care that I received during the challenging time in my life. Few months ago, in the month of February, I experienced a sudden and severe headache followed by vomiting. The headache worsened significantly and I was admitted to a nearby hospital. However, after a day of observation, they couldn't diagnose my condition, which left me and my family very worried. One of our family friends suggested we go to Apollo Hospital OMR Chennai, where Dr. Anil Pandey, the senior most neurosurgeon, was known for handling critical cases. Without delay, I was shifted to Apollo OMR. As soon as I arrived at Apollo, the medical team quickly assessed my condition. Dr. Anil Pandey and his team explained my situation in detail and recommended immediate surgery. They were transparent, professional, and empathetic, which gave my family a sense of relief in such a stressful time. I underwent not one but two critical operations. Throughout this period, the staff at Apollo Hospital ensured I was comfortable and well cared for. Dr. Pandey's expertise, coupled with the state-of-art facilities at Apollo, played a crucial role in saving my life. After the surgeries, the hospital's rehabilitation and post-operative care team worked tirelessly to help me recover. They not only focused on my physical health but also supported me mentally, which was equally important during this journey. Today, I am back leading a normal life, all thanks to the extraordinary team at Apollo Hospital OMR and, of course, Dr. Anil Pandey. I cannot thank them enough for their timely intervention and unparalleled care. If anyone is facing a similar situation, I wholeheartedly recommend Dr. Anil Pandey in Apollo Hospital OMR. The doctors, staff, and facilities are truly world class. You can trust them with your life. Thank you, Apollo Hospital, for giving me a second chance at life. I'll always be grateful to you and your team. Thank you.
the patient reported outcomes are the most important thing. So in another case, it's a 42-year-old male IT engineer. He already had coronary artery disease, an anteroseptal MI, and then had a cardiac ventricular clot, underwent embolization, left, and then he developed a sudden deterioration and a left cerebellar infarction with acute hydrocephalus was picked up. He again went an emergency left posterior fossa decompression surgery, EVD, and fortunately in him he did not require a permanent ventriculoperitoneal shunt unlike the last lady who could not tolerate the removal of the EVD and required a shunt. IT engineer. This is a third case, which is a much more difficult case, and this 29-year-old lady developed bilateral vertebral artery occlusion causing bilateral cerebellar infarcts. She was admitted and thrombolized, and then she also underwent a mechanical thrombectomy, which was done. Unfortunately, she progressed to develop hydrocephalus, and as you can see in the sand that we did an emergency EVD, and then she became unconscious, and then she had to undergo a posterior fossa decompression and CSF diversion. In fact, in this particular case, I had to do a extensive decompression, and we had to revise the decompression because the first time, although she became a little better, but still the amount of infarction was so. She had a very stormy post-operative period, but she improved and recovered in her impaired lower cranial nerve function, and she was also weaned off from her tracheostomy. She is still doing well in another city. This is a case 4, a 31-year-old gentleman. Again, notice that these are all, because this Apollo is located on the IT corridor, all young people having this type of strokes, and this 31-year-old had severe polytrauma. He had a diaphragmatic rupture, and then while he was in the critical care unit, he developed a right cerebellar infarct with acute obstructive hydrocephalus, and we had to do an emergency decompressive craniectomy and EVD, and then that had to be converted to a ventriculoperitoneal shunt. And patient reported outcomes are the best, and so let him recount his own experience. after the procedure, he is back and he has got restaurants, he runs a business, and he is very active, and this is his story.
Hi,
Hi,
this is
this is
Gopala
Gopala
Krishnan.
Krishnan.
In the year of 2019 January, I met with a road accident. For that, I took a treatment in Apollo Hospital's OMR. On an outlook, it shows that the scar in my chin, that's the effect of my accident, but it's not. After getting my first scan, it shows that all my internal organs in my abdomen got collapsed. For that, the surgery was happened on the same day night. And the next day morning, I was totally conscious, and I started responding to the people, doctors, experts, as well as to my family. They were so happy. There, the tragedy what happened started. Because the next day, that's the second day in Apollo, I'm in unconscious. The doctors on their toes, they immediately take me to CT scan, and the report result says that there is a stroke in my brain. It has been shared to Dr. Anil Pandey. Thank God, from there, I'm into Dr. Anil Pandey's control. Immediately, they have planned for a surgery. It's a dead alive surgery. It's about 6 hours of surgery. After the surgery, the next 2 days, I'm into ICU trauma, and by the time I started getting my senses. And another surgery which has also happened after this major surgery, that is on 5th day of the surgery. And after the surgical parts gets over, I'm into hospital for the next 35 days. During the time, I must say how much cautious they took care about my health. Equally they have been responded, equally they have given to my wife health condition too. Because by the time my son, that he is 3 months old, they were so much helpful and very much supportive mentally to my wife. And then after I got discharged from the hospital, I get a very good immersive response from the team from the Apollo hospitals, because I was completely paralyzed, and they have been recommended and they suggested good physios and treatments, periodic. They suggested me to come visit hospitals to check with my health conditions then and there. I'm really very much thankful to Apollo team and Dr. Anil Pandey. I take this as a great opportunity for me to show my respect and my heartfelt thankful to their team, because when I just step into hospital like a broken cup, and they given back to my family in a golden salver, and also timely interventions, patience, and dedications of Mr. Dr. Anil Pandey. Now I'm here. I'm really thank you, sir. Thank you so much for this opportunity to thank you directly in front of all. Thank you all.
Patient outcomes are very, very important, and these are things which we need to remind ourselves that, this is another case number 5. It's a doctor's father, and in him I had a little bit of a complication, because as you can see that this left large cerebellar infarction with acute hydrocephalus. After we did the CSF diversion, he had, as you can see in the middle scan, that he had what is called a reverse herniation, an exceedingly rare thing which led to a prolonged morbidity for this patient. But then this is what we need to see and realize, that these posterior fossa infarcts can have devastating consequences, and the reverse herniation is one such condition. Now in these patients, as you can see, the amount of infarcted cerebellum can be huge in a posterior fossa, and many a times we would be forced to widen our cranectomy, and perhaps like in the supratentorial area, the cranectomy needs to be really wide when you are suspecting that the infarction can progress. In the conclusion, what I would like to see is this is a very famous book which started the process of not the process, rather the stream of preventive cardiology, which has become now an ocean, especially in the US, where we have to read this book, Reversing Heart Disease. Now Dean Ornish started a revolution where he sort of put the ball in the patient's hand, and ask them, you also can do a lot more rather than just doing bypass surgeries and this and all that stuff. So I have one of my patients with a basilar artery thrombosis, whom we managed conservatively because he did not have very large cerebellar infarcts, and he was managed by our interventional neurologists and interventional radiologist, Dr. Sengotwan. But he was under our care because we were scared that he would do that, but he will tell you in his own words what he did. And this I take from the neurosurgeon Sanjay Gupta, whom I really respect and appreciate, where in his book Chasing Life, he says that a lot of things which we neurosurgeons can really help the society is by advising them how not to need us. You understand, you should not require our services to save your life, but you can do a lot of things on your own. So let us hear this gentleman. He speaks Telugu and his English is this, but he conveys his message quite well.
I died cerebellar infarct 2023 14th April. I am referring of the Anil Pandey sir. నేను వచ్చి జాయిన్ అయిన తర్వాత దాదాపు నేను 1 వీక్ పాటు హాస్పిటల్లో ఉన్నాను. వెన్ ఐఎమ్ జాయినింగ్ హాస్పిటల్ సీరియస్ కండిషన్లోనే నేను జాయిన్ అయ్యాను. సార్ ట్రీట్మెంట్, రెగ్యులర్ ట్రీట్మెంట్ అనేది నాకు చేసిన తర్వాత నేను రికవర్ అయ్యాను. నేను హాస్పిటల్లో జాయిన్ అయినప్పుడు మై వెయిట్ ఈజ్ 90 kgs. నౌ మై వెయిట్ ఈజ్ 72. ఆల్మోస్ట్ 18 kgs డిక్రీజ్ అయ్యాను బికాస్ ఆఫ్ ఓన్లీ రికమెండింగ్ అనిల్ పాండే సార్. అనిల్ పాండే సార్ స్ట్రిక్ట్లీ ఇన్సిస్టెడ్ కంపల్సరీ యువర్ వెయిట్ లూజ్ వెన్ ఎవర్ able to recovery normal, compulsory your weight was reduced then your normal. That's why I follow the yoga, strictly yoga and diet and walking. After 1.5 year I am my weight to the 72. My brain condition is normal. I am check up every came to here every 3 months regular check up, still onwards. Now my diabetes also recovered, my brain clots also recovered, everything is recovered. Now I am in the normal patient because of only Anil Pandey sir sessions. In our Apollo hospital, hospitality is excellent hospitality. Our sisters, our nursing specialties, especially for every excellent taking care of to me or everything, diagnosis, పర్సనల్గా బాగా టేక్ కేర్ చేస్తారు వితౌట్ ఆస్కింగ్ ఎనీ. హాస్పిటాలిటీ ఎక్సలెంట్ హాస్పిటాలిటీ, ఖచ్చితంగా మంచి నర్సింగ్ సిస్టమ్ అయితేనేమి, హాస్పిటాలిటీ అయితేనేమి, కేరింగ్ అయితేనేమి, మంచి కేరింగ్ తీసుకొని ఎప్పటికప్పుడు రెగ్యులర్ చెకప్ చేస్తున్నాను. నా యొక్క హెల్త్ కండిషన్ని బాగా తగ్గించారు. దానికి గాను అనిల్ పాండే సార్కి, హాస్పిటల్ వాళ్ళకి, హాస్పిటల్ యొక్క నర్సింగ్ డిపార్ట్మెంట్కి నా యొక్క కృతజ్ఞతలు. నేను రికార్డ్ అవ్వడానికి కారణం ముఖ్యంగా అనిల్ పాండే సార్ సెషన్ అండ్ హాస్పిటాలిటీ టేకింగ్ కేర్ ఆఫ్ అవర్ ఎంటైర్ ట్రామా నర్సింగ్ డిపార్ట్మెంట్.
So as you can see, I made these three young people tell you their experience after having a posterior fossa infarction or a stroke, and how they came out of it. The last one is equally or probably more important than the others, where if you notice that by reversing his obesity and his risk factors, he is actually off his diabetic medication and his hypertensive medication, and that too not by himself but by the endocrinologist Dr. Leela at our hospital and Dr. Arul. They have taken him off, and his metabolic syndrome has been actually taken care by himself by the sheer process of making sure of a healthy lifestyle and reducing weight. So this knowledge which Saraswati signifies is very, very important for us, that these can happen to young people, and that the entire population, especially among Indians where high incidence of strokes are there, we should be careful. Thank you for your attention. Thank you so much.